In this video, we will crown skull indentation in adults, 6 causes, 5 treatments and symptoms. So let's start now. Crown skull indentation in adults is quite common these days but shouldn't be ignored. So, if you experience a change in the skull shape, immediately see a doctor. But, before visiting a GP, you are advised to take proper note of the symptoms, triggers, and causes behind dents in the head because they often occur as a result of trauma or some diseases. Look Broad encourages people to talk about health issues and provides expert over-the-counter guides to deal with problems, with pertinent information on when to see a doctor. This is yet another health manual for people complaining about having dents on the scalp or different head parts. Skull indentation in adults' skulls come in different shapes and sizes, making the different face shapes in all humans or even kingdom Animalia. But, sometimes, people see dents or dips on the different parts of their head, skull, forehead, and scalp, as a result of some health condition. So, if you notice a change in your skull shape or in the head of someone you know, make sure to take immediate action and be prepared to see a doctor. Crown skull indentation in adults. Symptoms as a result of skull indentation in adults, also known as skull depression, one can experience dent in head, dent in forehead, dent in skull, dent in the back of the head, dent in scalp, headaches, vision difficulties, memory loss, swellings, increased risk of fractures. According to advanced research papers, experts have found that men are more at risk of skull depression. However, some other studies have also argued that women's skulls are mostly filled with hair, and it is not easy to find dents in the head without a bare scalp. Until and unless you experience symptoms like headaches, memory loss, and vision difficulties and go for a proper checkup and test, we cannot identify skull indentation in adult women. Why do I have a dent in my head? Crown skull indentation causes. Crown skull indentation in adults is more common in men, but women are not spared from it. Regardless of gender, explicit life experiences or issues can result in a dent in the head. What can be the causes behind having dimples in one or different parts of the head? Scroll below to find the details. 1. Craniosynostosis. Sometimes, people are born with such issues and dents in their skulls. Babies remain safe in the mother's wombs, but their position there can play a role in developing skin depression. This can happen due to a problem in the birth process or the position of the baby at the time of delivery. With this, the skull of the fetus fuses prematurely, resulting in posterior fontanelle dents or any part of the skull. However, this needs proper examination and checking from a practiced professional to find out the exact whereabouts of the issue.